I'm a fellowship-trained orthopedic oncologist. I trained at the Memorial Sloan-Kettering Cancer Center. In that training, I was educated in the surgical treatment of sarcomas, both in children and adults. The practice of orthopedic oncology is very broad, and it requires understanding the biology of these tumors and also the biology of children, which is very different than adults. Many factors go into what treatments are selected for a child versus an adult. And in my training, I've been prepared to deal with the spectrum of tumors from ages 1 to 99. Orthopedic oncologists specialize in the surgical treatment of sarcoma. Sarcoma is a rare type of cancer that arises from the musculoskeletal system itself. Soft tissue sarcomas are very rare types of cancer that arise from muscle, blood vessel walls, nerve tissue, and even fatty tissue. Soft tissue sarcomas require surgery to treat definitively. Bone sarcomas are very rare types of sarcomas that arise from bone primarily, as opposed to a type of cancer that spreads to bone. Sarcomas that arise from bone require surgical resection. After the tumor is removed, there is often a defect in the bone that needs to be reconstructed. We use a combination of endoprostheses or metallic implants. Sometimes we use bone that's derived from the bone bank. Other times we use tissue transfer methods to reconstruct the deficit in bone and to optimize patients' function after treatment. Being a surgeon scientist with interest in sarcoma research offers the opportunity to integrate with local researchers, in particular those at the Van Andel Research Institute and Michigan State University College of Human Medicine. There is robust sarcoma research being done in Grand Rapids, and it has been done here for many years. The opportunity to join those researchers in combination with a clinical focus on sarcoma offers a very unique opportunity to advance the treatment of this very rare cancer. What wakes me up in the morning is my opportunity to help patients that have very rare types of cancer in a number of ways. Being that I see patients clinically for these rare types of cancer, such as sarcoma, and that I do research on sarcoma, I see both sides of sarcoma. The surgical treatment of sarcoma can be challenging, and I thrive on that challenge. The challenge to take a very complex problem, find the best solution for it, and counsel the patient and offer emotional support throughout their course of treatment. On the other hand, on the research side, I like to investigate what makes the sarcoma be aggressive and find out what makes it tick and try to come up with creative ways to counteract the sarcoma and treat the sarcoma. The surgical treatment of musculoskeletal tumors is a very unique skill set. Very few practitioners are comfortable with this aspect of management. Being that I am in West Michigan, it offers patients within the Spectrum Health System and outside the opportunity to access this type of care closer to home.